all. I am Emanuel, as Robert mentioned before, the president of the Medical Society, and welcome to our Healthcare on Wednesday, Washington Healthcare on Wednesday. And today's topic is July Advocacy Forum. We'll be learning more about our DOCPAC during the first half. In the second half, we'll talk about our monthly advocacy forum of issues that are important to you that leadership should know about and what role we should take. But before we begin that, I'll give a short opening about DOCPAC. It's an important advocacy tool for the society where we can donate to candidates that support causes that are important to us as physicians. We are entering a new political campaigning era, and candidates are seeking our support. And DOCPAC is a way in which we can turn our focus towards the future. So without a delay, I'd like to introduce the chair, Dr. Marc Rankin, and the treasurer, Dr. Byron Cooper. Gentlemen, please take it from there.
Ryan, you want to start? Well, I'll introduce myself, Marc Rankin. Thank you, Dr. Emanuel. I guess I've been the chairman of DOCPAC for now, probably about going on 12 years. I've taken over from Dr. Walter Baggett, and he was the head of it. And it seemed, early on, we had a more robust DOCPAC group. The landscape, the healthcare landscape was a little bit different than it is now. And so we're not as active as we have been, but we have been in the past meeting with the members of the council to go over various legislation priorities and have our input. Is the best way that we can get our members to have a voice and a say in the council in their meeting. Within the last 10 years, as I said, that the landscape has changed with being more heavily federally involved with healthcare. So we didn't have as much input as to what was going on, particularly with the implementation of the Affordable Care Act, because a lot of these were mandates, and so we had to kind of comply. So through the years, we've kind of, I won't say taken a back seat, but we haven't been as active as we have in the past. And I think the impetus for this meeting is to kind of see where we go and how we retool and what we can do to have a more powerful voice going forward, recognizing the fact that the situation has changed, but we still want to have a voice for our members. And also, quite frankly, from a financial standpoint, we do have to report the finances of annually of what we're doing. So we really just kind of need to have some input here as to where we go. And that's pretty much all I have to say. Brian, if you'd like to take it from here.
Yeah, let me see if I'm doing this. Now am I on? Okay.
Yes.
Okay, good. So I agree with Dr. Rankin. In the earlier years, in the early 2000s and many years before that, there were active fundraising meetings with DC candidates as opposed to national candidates. And people were heavily involved. And it's not entirely clear why, it fell off. I guess the reasons you gave are apt. And I don't know how much of it is the inertia of getting people to donate or whatever. I think the question came up, should DOCPAC even continue? And I would say right off the bat that if you didn't have somebody like Rose Smith, it would be, under any circumstances, it'd be hard to imagine it could continue, because for as long as I can remember, at least 20 years, Rose has done like if you can rate people on a 10-point scale, she'd be about a 20 in terms of getting all the filings and deadlines and all these other things. And I think we should hear from her, hopefully. I don't have any problem continuing as treasurer. I live in DC. It used to be a requirement that you had to live in DC to be treasurer of DOCPAC. I don't know if that's still true or not. But I'm happy to continue if that's the consensus of membership, et cetera. Before the meeting actually fundamentally started, the question was, well, if we disbanded it, how easy would it be to start all over again? And apparently not that easy, because you'd have to get somebody to agree to meet with the government for a training session or more. And, doesn't sound like an easy thing to do. So I'd like to see it continue if there's a consensus that we're actually going to do something going forward. That's really all I have to say.
Is anybody, Rose, would you like to weigh in? Any thoughts here?
Well, the last time we did a solicitation to the membership to contribute to DOCPAC was in 2017. We did a 2-year, so whatever we billed, it was $100, very minimal. 51 2017, the rest went to 2018. We only collected $2,100. The current balance in the fund is $1,700, and it goes down maybe a couple $100 a year based on Robert's time, my time to administer the fund. So the funds aren't gonna last much longer. I mean, a couple years, but depending on what you folks decide to do. The campaign finance reporting, it varies from year to year based on whether it's an election year or not. During election year, there's more reports because you need to file before a primary, after a primary, before the general election. So there's more reporting to do, but with such little activity, it's a matter of going in, and it's all electronic. It's easy to do, but there's more. And if you decide to not support candidates, then Dr. Cooper needs to go to get his signature notarized on a form that says you're not going to contribute to a candidate during the election year. My question is, if we're not going to contribute or support candidates, I'm not sure what the purpose of the PAC is then. I'm not saying we should disband it, but it's been very dormant for the past several years. So it's just there.
I guess one of the things I would ask, maybe getting a better idea as to who else in our organization feels that how they would feel about DOCPAC, to have them weigh in, maybe get a survey of some sort, and actually kind of ask them even before they participate what they feel the top legislative issues are with respect to healthcare in the city. I mean, these things have changed. A number of hospitals have closed. You have other hospitals that are opening, and you have just a whole sea change in terms of just the healthcare landscape in general. And so just kind of getting maybe a list of the top 5 priorities, and then seeing what the legislative agenda is that the council has, and seeing if that matches up with it. So before really making a decision about whether or not to disband DOCPAC, sending some feelers out to see what the rest of our membership feels about it. And that way we can make a decision. Now I know, you'll have to help me with this, I know that DOCPAC is supposed to be separate from MSDC in some respects. Isn't that right? Shouldn't we have a hands-off approach in some way to make it so it's not a direct relationship, but somehow send out information? How would that work so we stay within the guidelines and not break the rules? Just send out like a survey to our membership or the DOCPAC membership. How many people are actually members of DOCPAC? It was 50 at one point. Do we know? Maybe less.
Exactly. I mean, there's not many more than that. I would have to even go back and see who contributed in that 2017-18 year, which is easy enough to do.
See,
but
working. A lot of folks may have been retired since then.
Exactly.
So I guess there may be new members of MSDC who don't even know what the DOCPAC exists. So I guess somehow before making a decision, getting that information out to our membership and then seeing what their take is on it, because obviously young doctors or doctors who are just starting out in practice are going to have different opinions as those who've been in practice for a while. So I think prior to making any decision about going forward and how to go forward, getting the temperature of some of the membership and see if they'd even be interested in joining DOCPAC.
Hi, this is Ashish. The ACP has their own PAC, and the relationship between ACP and their PAC is similar to, I believe, MSDC and this thing, DOCPAC. So for the ACP at least, ACP PAC can give sort of like informational emails to ACP members saying, here we are, please join us, that kind of stuff, but not survey type stuff, like not stuff that you're talking about. So that would be only for DOCPAC members. So, but you're right. I also, before I actually got this invitation, I was minimally aware of DOCPAC myself, actually. So I think it would be reasonable to publicize DOCPAC to general membership of MSDC, and then by doing that, maybe you can increase your numbers, and when you have more numbers, then maybe those surveys would have more meaning potentially.
Even like having a presence at, like when you last week when you had a gathering or something out there, they're just putting information out that like that, just kind of spreading the word, meeting people face to face, as opposed to just trying to rely on an email or a phone call. But I think having a strategy or strategizing a way to get our information out to our membership, and then that way, once we get an interested core group of folks, then we can have a more fruitful discussion about what the legislative priorities would be for our members and match that up with what we see that's going on with the council over the next calendar year, fiscal year, or just in general. And in that way, we can make an informed decision about whether or not we want to proceed with DOCPAC in this form, or maybe have it in some other form of a fundraiser.
Well, you brought up a good idea, and it makes me think, well, maybe if we get that going, as Dr. Rankin just suggested, we could then actually send a membership, solicitation, and, see if we can get more than 50 people to pay the $100, or even if we got the 50 to do it. Then we'd at least we wouldn't have the situation that Rose mentioned that, we'll just run out of money.
Anybody else? Please chime in. Robert, Dr. Emanuel.
Yeah, I'll defer to the members on the call. I'd like to hear their thoughts.
Hi, go ahead.
Hello.
Dr.
Yeah, this is Mel Williams, and unfortunately, I have not been involved. So maybe, as mentioned, a little brief scenario about DOCPAC, as to its vision, as to its mission, insofar as it relates to practitioners, physicians in the city. So I think if that went out, that could be further disseminated, and I can, on the other side, try to, Walter Faggett is a member of MedChi. So I think some dissemination of information, that would be a good start. And that could be a basis for which to conjure the interest of some. So because as one, as you say, if you haven't been involved, you're probably not aware of the little the specifics, what have been going on for the last couple of years, et cetera, et cetera. So basically, you know, a little statement of that effect, and a brief little history and as to the merit and necessity of the organization.
You know, I think when we look at our membership, this is EW Emanuel, the 88% of our membership are employed. They're not in private practice. And I can tell you from experience that these organizations, especially the large ones, have their lobbyists. They have their action pack committee, whether they admit it or not. And their interest is at the forefront. And I would say I would be concerned if their interest boils down to the individual physician's interest. With that said, I would strongly recommend that DOCPAC continues. And it continues in the form of representing the individual physician, whether they are a part of a larger organization or in a smaller practice, to shore up or to allow a voice for the physician separated from an employer.
Yeah, hi. Oh, were you going to say something? Yeah, I think one of the thoughts, and I don't know if this is relevant or not, is that, for example, I'm part of Privia. I'm not really an employed physician, but there are a lot of doctors who are part of Privia. And they actually cover a lady. So I don't know if that translates to, you know, a willingness to do, you know, PACs and things like that or not. But I don't know how that works.
So one thing that I'll mention at this point is that it's as you all are thinking about the future of DOCPAC and where it can be most effective. And correct me if I'm wrong, those who have had more experience with it, a lot of times the donations and the support have gone to campaigns and to constituent funds. And so really, as we're talking about how it can be most effective in helping independent physicians and so forth, what I'm hearing is you all talking about, well, how can we influence constituent funds and support candidates who support independent practice? And so that's something I'll throw out there for folks to think about is this the direction that you all are thinking about? You know, can we fundraise and give money to candidates and positions? And I just blanked on the initiatives that help private practice and the practice of medicine.
This is Ashish again, maybe focusing on the campaigns of our candidates for DC Council. That would be the most impactful, I guess, for or at least independent physicians in the district, and to some degree Maryland and Virginia sometimes. But for sure, if the goal is to support private practice or independent practice, not so much the large employed sort of groups, certainly talking directly to council would make more sense, and that would be the focus of fundraising and or donations, I think.
Also, it would be wonderful if the PAC, if it continues, would be able to support a physician running for council. We have a lot of lawyers on the council. We have a lot of community activists, but if any physicians got the political bug, running for office and getting support from MSDC would certainly be a role.
Do we have any documentation, any I don't know, like a scorecard of how we've done in the past, or who we've supported in the past, and how they've done? Any track record of how successful DOCPAC has been in the past? Is there any legislative issues we were on the side of that actually we supported? Is there a record of that? I know.
So looking,
go ahead.
no, I was just going to say, looking at the list of the last donations, I need to check when Yvette Alexander left the council, but overall, the donations made by the PAC were to campaigns and candidates who won. So you're looking at donating to Yvette Alexander, Mary Che, who's obviously still in the council, Vince Gray for mayor and for council, Michael Brown, that one maybe not so great in the long run, but that's fine. And then, as we mentioned prior to the call, Muriel Bowser for council. So it's the donations that have been made in the past have been pretty, for winning candidates.
Do the local chapters of, have, the pediatricians, ACOG, surgery, do they have any kind of DOCPAC equivalent? And if they do we coordinate with them?
That I don't know. I don't have any. I think those are more the national organizations. You mean?
I know ACP has a local organization, obviously, or local chapter. They don't have a local PAC, obviously. They have a national PAC. But I was just wondering if maybe some of the other organizations have a more local presence, or do they just go through MSDC? I know some of them do come through MSDC for lobbying.
Yeah, I just don't know. I don't believe so.
Yeah, not to our knowledge, no.
Yeah. Well, I know we're coming up on 6:30 now at the time. I guess maybe formulating some sort of a plan of action. I don't mind just kind of brainstorming a way to reach out to potential members, even get some people interested in becoming members of DOCPAC. And if anybody has a way, I have no problem writing a little paragraph of sorts and kind of explaining the history and the importance of it, or maybe just strategizing a way to get more people interested in or even understanding what we do, what it is that DOCPAC does. And however you feel, I'm ready. I'm certainly happy to do my part.
Does DOCPAC have its own website?
No, I don't think we do.
No.
I mean, that could be something to consider. I know ACP's equivalent of DOCPAC has its own website, and therefore the membership can be directed towards that website to see what kind of lobbying they're doing, what kind of activities they're doing, and of course to donate directly to that ACP's services, it's called. And if DOCPAC has a website or becomes a website, then whenever you do membership renewals, you can always say, here's a link to DOCPAC website in case you're interested in finding out more info and or donating directly through that website for them. You would probably get a decent number of people, or at least people looking at the website if there is one.
How expensive is it to set up a website? I have no idea.
Without one, it would be very hard to get generating interest, I think.
No, but I mean, how big a deal is it? I've never, I don't know how many other septuagenarians there are, but other than me, but is it expensive to set up a website, or is that something that's?
No, it's not.
It's not. This is Dr. Agrawal.
Hi.
I mean, I set up my practice's website and it was less than $1,500, but there's about $100, just to keep up the security and updates, but it's not that expensive. And there definitely isn't a website because I was searching for a website when I get on this call.
And depending on what company you use, you could probably spend less than $1,000 setting up at the initial site, and then maintenance, like you said, it could be like 50 to 150. It's very, very low key.
Got it.
Yeah, we could even spend less than that depending on the issue is how segregated does it need to be from the membership side of the website. I know at the federal level, there's strict rules about segregation of websites, but if it's as easy as setting up a page, then that's very cheap and easy.
Well, I mean,
just
it has
when you
to
dig
be
into
a
it.
separate website. So it can't be like, okay, MSDC website, and here's a tab, click on ACP services. They don't, that's not acceptable. And as far as I know, it truly is a separate website. But whoever is the webmaster for MSDC I'm sure they could just set up the actual website for DOCPAC and maybe give you some kind of discount for a 2-for-1 kind of deal or something.
Sounds like a plan.
Well, I also think the DOCPAC website doesn't have to be as robust as the MSDC website. So it shouldn't be as
Yeah, exactly. It should be very simple.
complicated.
Here's a list of policies that we support. Here's a list of candidates maybe we support, position, missions, that kind of stuff. Yeah, it could be a page or two. It doesn't have to be one, but certainly on that website, you would want a sort of a button where you can click to donate.
Well, not only that, but it could be functional in the sense that, you know, you could put up either a blog or periodic information as to what legislation's coming down the road, or what's on the legislative agenda as it pertains to. I think MSDC does that anyway.
Exactly. I mean, you could duplicate it for sure. You can have both information, same information on both sites. It would be helpful.
Okay, that's all pretty much I have to say. Any final good thoughts? Byron, Dr. Emanuel, Dr. Byron? Anybody? Next steps?
Well, my thought was it sounds like the consensus is we should not throw in the towel. We're to look into formulating a website. At the very least, that would produce enough collaboration that, you know, you might, it might work two ways. You might get some input on what's important to doctors and raise some interest.
You know, two friends of mine were on the council. I mean, it wouldn't be hard for me to get in touch with them since they're not on the council anymore. I don't think there's a conflict of interest, maybe having them talk to our membership to see what their take would be. And I could get Kwame Brown. He actually has his own cable TV show of sorts. I could have him speak to us, as well as Yvette Alexander. They're both good friends. And so maybe they can kind of help strategize, or help give us some, not strategy, but help give us some advice as to what their thoughts would be, since they've been through the process. So since they've been on the council, just a thought too. Just because, I mean, it's, you know, having some input from someone who's on the council, they can kind of give you some inside baseball as to how these things go. I mean, we certainly give our checks, but so do the trial lawyers, right? So the business folks. And so when we're up against them, it's kind of like, you know, going up against Goliath. And so having just someone who has some inside information is not a bad idea. And I have no problem reaching out to them if you think it might be helpful.
Yeah, having connections with council is really good, especially even if it's ex-council people, because they certainly, like you said, can give us that information. You know, apparently free information, I would think, potentially. So it's always a good price. So, but yeah, it would be very.
They love to talk. We'd be happy to do it. Well, just kind of put a bow on this. I have no problem just doing, like, I could write a little follow-up SWOT analysis plan, a strategic plan as to what I would think, and I could just send it to Robert. Maybe you could circulate it and see what you all think, and then we can just take it from there. How's that sound? And Byron, I can say we can collaborate together. Byron, whatever you think, whatever you want to do. I mean,
No, I think that makes sense. I don't know if you want to talk to me later at some point, or.
Absolutely, I'll be happy to reach out to you. I think it'll be a great idea.
Okay.
All right. Okay, well, thanks. I guess that's all I have to say. I don't know if there's anything else.
Thank you. So are we planning, I guess with the SWOT, we'll decide a next meeting, or will we spread news on information on a new site, web page?
Well, we could decide whatever you think would work best. I think from a time standpoint, I think it wouldn't take me more than a week or two to just kind of get something on paper and kind of look, kind of see if that you can, like, to send it to you to see how you think would work best, and then a decision can be made at that time.
Okay, the decision will grow as we get more information. Sounds good.
Right.
Thank you. Any other comments or concerns? Thank you all. We're going to move into our second half.
Ian, I think I have your email address. I'll send you my contact information. Dr. Rankin.
Sounds good.
All right.
Thank you, Dr. Rankin. Thank you, Dr. Cooper.
And thank you,
Great
everyone.
job. Okay, we're moving into the second half, our monthly advocacy forum. This is where we can discuss with MSDC leadership political issues that you find important to you and your practice. Any updates that you would like or topics that you would like to share with us? Anything we need to be aware of to keep on our radar?
I have a thought. I think that one of the things, and I don't know if this fits into what everybody else is set to talk about, is one of the issues that is already occurring is mandatory vaccination for healthcare workers. And this is a point of concern. I'm sharing a space with other people, and there are one or two non-doctor employees who refuse to be vaccinated, and there are concerns by the employers of that person. Well, we'll be sued if we fire her. And it doesn't really matter what my opinion is, which is not successfully, but I think this is something that is going to be of increasing concern. The hospitals are dealing with it, and the federal government is dealing with it, but whether the employer is GW, MedStar, Howard, et cetera, this is going to be an increasing issue. So I don't know if that is within the scope.
No, it's within the scope. It is something that, Robert, remind me, I think the hospital associations have, in the 3 jurisdictions, have decided or voted that all employees of a hospital should be vaccinated. They recommend.
DC and Maryland. I don't think Virginia's officially done it yet.
Okay. DC and Maryland. So as you said, Dr. Cooper, it is an issue that's growing. I was surprised when I heard today that the president states that all federal employees should be vaccinated. And if the federal government, not being part of the healthcare industry, so to speak, directly, but indirectly, is making that stand, then I would say that we're going to hear more of it locally. The question becomes, as MSDC, what's our position on that? And I think we need our members to be vocal. Dr. Patel, I saw your hand.
Yeah, so as you know about that Texas hospital that required mandatory vaccinations, and the nurses sued, and it went to a court case, and they lost because the hospital is a private business, and as a private business, they can require vaccination as a condition of employment, even if the vaccination is after the person was hired in that position. So when Dr. Cooper is concerned about a person in his office or in his shared space, if they do decide to require vaccinations, that person really won't have any standing in terms of suing the employer, because they'll lose for sure. As far as MSDC, yeah, I mean, I think we should be pro-vaccine. I mean, it would be reasonable to say that that hospital or healthcare entities, we support them requiring vaccinations. Or at the very least, we support healthcare facilities, wanting people to be vaccinated. But going a step further and supporting mandatory vaccines, I think is reasonable, especially from a healthcare and scientific standpoint.
Yeah.
And I think GW already is requiring it. Georgetown, I think, is requiring it. there's already places requiring it. So I mean, this is not a big leap of faith, I don't think. If we go ahead and say we support this also.
Would it be
So the-
worthwhile to poll the members?
It would be. I mean, sure, you could. I mean, I have a feeling that there might be a lot of smaller independent practices that may say, no, we don't want this. I mean, that would be the irony of the new private practice section, I think, is that a lot of the large entities would say yes, and the smaller entities might be like, hey, no, don't tell us what to do. But yes, that's a risk, I guess. I mean, I'd be curious to see what happens with that. But I have a feeling, yeah, if we polled people, I have a feeling it would be not a slam dunk, probably.
But I guess I feel that we could mandate it. That could be our platform. But I think that especially for smaller practices, or you can't just say, I'm going to fire that person if they don't get the vaccine. I think it may be that
Oh, I'm not
that's
saying
our
we should
stand,
support
but
firing
we
people.
also
I'm
say
just
there's an option that maybe they have to get tested every week. And if the mask mandates go away, that they may still have to wear masks if they're not vaccinated. I mean, I think we can say this is what we stand for, but if you don't do that, then you have these other hoops you have to jump through if you're not going to get vaccinated for whatever reason.
Yeah, some of these entities that are requiring mandatory vaccines, if they allow non-vaccination, then yeah, they're requiring testing once a week and masking and that kind of stuff. So that is true. That's definitely true. I'm not suggesting we should support people getting fired. I wasn't suggesting that, but I think supporting mandatory vaccines and maybe some alternate, requirements would be reasonable.
Yeah, but I would say when a company requires and the employee is not compliant, then there's a repercussion. And the repercussion doesn't have to be termination. As you said, it could be, mandatory testing on X frequency at X frequency. It will generate, I would say, more cost for the smaller practice, unless we're saying that the employee has to pay for the testing themselves. I would suggest that our first step is to poll our members to find out where do they stand in this.
I mean, a poll could be two things. One, of the members who has been vaccinated, how many members have been vaccinated, because maybe we have a 98% vaccination rate in our membership. Who knows? Maybe it's 80%. And then the question two would be, who is doing these policies? If there are any policies, who's mandating them, who's not mandating them? That's reasonable. Now, getting data for sure is a good idea.
I think that I worry about if we do a survey that we can look at ideally what we want and then realistically what you can do or what, so that may be different. And that, yes, I think when you look at the study data, everybody should say, yes, we should mandate vaccines, but then you run into, what am I going to do if we have to have all these staff tested every week and they're leaving the office to go get tested somewhere else and I have no staff? I worry that the idealistic versus the realistic don't match. So when we take a poll, is it really going to be scientifically based, or is it going to be what's feasible in that person's situation?
Well, I agree. I think, though, being transparent with the survey, MSDC would like to take a stand as it pertains to the COVID vaccination of healthcare workers. And we would like to know your stand, your opinion, your thoughts on this. We can't operationalize whatever result we get, but we can report to them, being transparent, our membership feels as though X, Y, and Z. I'm not sure if it may be helpful for us to recognize or ask. Ideally, yes, we know you. What is your stand? And on a practical level, do you think this is something that healthcare facilities, both large and small, can accommodate if it is mandated?
So there might be a different focus. I think I may have misunderstood or maybe misunderstood what I said. So I don't think we certainly can't mandate anything, right? So we can't tell people that you need to get vaccinated. We could say we as an institute, we as an organization support those entities that mandate vaccinations. That way, if they're already mandating it, we're just saying we support them. If they're not mandating it, we're kind of implying that maybe you should, but we're not saying that directly. But so I think that might be where you're kind of that might assuage your fears about what we're trying to say to people. But if we just say we want people to get vaccinations and mandating, and everybody should get mandated vaccines, that may be too strong a statement. But we could just simply say we are in support of any healthcare facility or employer that mandates vaccines, and just leave it at that, and then they can interpret what they want from that.
And if we're already doing a short survey, I think one of the questions should be, have you been vaccinated? I think it does make a difference. I think one of you said that. And then I think the other question is, have they had COVID? I think it may just be interesting to see the percentages of who's vaccinated and has had. And, like, unfortunately, I had COVID, but I had it before we could get vaccinated. So it would be interesting to see if those people that are pro-vaccine for healthcare settings are actually the ones that got COVID from a healthcare setting.
Yeah, that would be interesting. I think there are more. I think there's a large percentage. I can't tell you numbers of us who've been COVID positive or infected long before the vaccination. And I would say where I work, the majority are vaccinated, both health, the staff, physician and staff. But there are those, we have people who are not vaccinated, not the physicians, but staffing. And because of issues of trust, it's clearly not an issue of education or understanding, it's issues of trust. And these are both who have been infected versus those who have not. I say all that to say, one, I wonder how forthcoming our membership will be as far as prior infection. And two, the honor system, have you been vaccinated or not? I know if you're admitting to a MedStar or a large hospital, by September, most are saying we need proof of vaccination. So I'd be curious to know that information.
Just a comment here. Also, the rationale will continue to change, such as folks in private practice, their patients might say, is your staff vaccinated? Before I come and see you in the office, et cetera, et cetera. So,
yeah.
And then, of course, the state governments, you see in New York State, New York City, the restaurants in Virginia that are mandating you can't come in the restaurant unless you're vaccinated. So there's going to be a groundswell for certainly advocacy for vaccination. And also, we're talking about Delta, next it might be Epsilon. So this picture is going to continue to change. Yes, Epsilon is next.
Yeah.
I think there's already a Lambda, actually. So yeah, we've already moved beyond Delta. But you're right. I actually had patients who, early on, January, February, ask me, have I been vaccinated? Am I going to get vaccinated, before they either decide to get vaccinated or come to the office. So yeah, there is some peer pressure from patients. So hopefully doctors are paying attention to that, or staff are paying attention to that.
Okay, so I hear that we would or would like to have a simple, small survey on people's position on whether as a group, we should mandate or strongly encourage vaccination. I think we're doing that now. So the question would be, is mandating of healthcare workers important or necessary? And two, being forthcoming and questioning whether you've been vaccinated and have had COVID in the past. Is that correct, Dr. Agwal?
Yes.
Okay.
I mean, it's a little aside, but while we're sending a survey, we might want to get that information. And I think that it would be interesting to see if the people that are more mandating vaccines are the ones that had COVID versus the ones that haven't.
I see your point. Yeah.
And when you say healthcare workers, I think you had alluded to yourself, the physicians, I believe, are more likely to be vaccinated. And you're talking about staff who may be more likely to be resistant. So there's a sort of dichotomy there. So when you say mandating, we support mandating vaccines. I mean, we have to also clarify, we're just talking physicians only, or are we talking about physicians and staff? So,
it was healthcare workers. From experience, prior to COVID, I was, in my previous role at Kaiser Permanente, the physician that strongly supported and enforced that healthcare workers were vaccinated against the flu. And I can say to you, from issues of trust, not education, trust, our medical centers that had predominantly African-American physicians as well as patients were on the lower end of vaccination. And when we cross-reference that information, physicians that did not become vaccinated did not encourage their patients to become vaccinated, and their staff wasn't vaccinated. When we mandated it, this 40% went up to 90%. And we saw a shift also in the staff as well as the patient population. So it'd be interesting to know, one, who's vaccinated, and two, whether or not they encourage a mandate for vaccination, because I think that's directly related to the staff as well as the patient population.
I agree. I mean, if we're just saying mandating healthcare workers only, and that technically does include the staff like front desk and all that kind of stuff. So if we say we support organizations or entities that mandate vaccinations for all employees, healthcare workers and staff, that might have more impact, because we can always say just healthcare workers, which I think is already happening, and then the staff are kind of let loose. And like Dr. Melvin was saying, you know, a lot of patients are more interested in the staff being vaccinated because they all know the doctors are probably vaccinated. So if the staff aren't vaccinated, they don't want to deal with that entity. So, so I think my gist is the most important aspect of all this is having the staff get vaccinated, because I think the majority of healthcare workers are being vaccinated. I understand, yes, in the African-American community, even physicians may not be so reliably getting vaccinated, but the staff for sure is not getting that. So, so I think the focus really needs to be on, I guess, staff. And I think that's why all these mandatory requirements are occurring, because they're really trying to get the staff to get vaccinated versus the actual doctors, nurses, those kind of people.
Yeah. Okay. Any other topics of important that we should be aware of, that we should keep on our list to discuss later?
Did it get to District Taco?
Yes.
I'm sorry, I didn't hear that.
No, that was a little background.
Oh, okay.
An orthopedic PT.
Okay, that was good. Thank you,
That's my
Dr.
son.
Williams.
I'm in the
We
car.
needed that little icebreaker.
Physical therapy. Got a mean fracture of the femur, so I'm working with that.
Okay, thank you. We're happy to participate. Appreciate it. Okay, any other topics? All right, I think we I'll discuss a little bit more with Robert about how do we approach, what's the next steps in one, generating a survey and positioning our stand on vaccination and mandating it. ... It is 6:55, and if there's no other topic, I elect to adjourn the meeting. Thank
Okay.
you all
Okay,
for joining.
everybody have an enjoyable evening.